Understanding the difference between HIV and AIDS. HIV and AIDS are terms often used interchangeably, but they represent different stages of the same health condition. Understanding the distinction is crucial in managing and addressing the condition effectively. Here's a clear explanation with relatable examples to help clarify these terms. What is HIV? HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the immune system, specifically the CD4 cells, or T cells, which are essential for fighting infections. Over time, if left untreated, HIV weakens the immune system, making it harder for the body to fight off illnesses and infections. Think of HIV as a silent intruder breaking into your body's defense system. In the early stages, a person might not feel sick at all, even though the virus is actively multiplying in their body. For example, Sarah, a 30-year-old, was diagnosed with HIV during a routine health check. She felt healthy and showed no symptoms. After her diagnosis, her doctor recommended starting antiretroviral therapy, ART, a treatment that helps control the virus and prevents it from progressing. Today, Sarah continues to live a normal, healthy life by adhering to her treatment plan. What is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome and is the advanced stage of HIV infection. It occurs when the immune system becomes severely damaged, and the number of CD4 cells falls below 200 cells per cubic millimeter of blood. A normal range is 500 to 1,600. At this stage, the body is vulnerable to opportunistic infections and certain cancers that it would typically be able to fight off. AIDS is not a separate disease but rather a condition that arises when HIV is left untreated or inadequately managed. It's important to note that not everyone with HIV will develop AIDS, especially with early and consistent treatment. For instance, consider John, a 45-year-old who was unaware of his HIV status for many years. He began experiencing recurrent infections and weight loss, prompting a visit to the doctor. Tests revealed he had AIDS. Although John's immune system was significantly weakened, starting ART helped stabilize his condition and improve his quality of life. Key differences between HIV and AIDS. HIV is the virus that causes infection. AIDS is a condition resulting from untreated or advanced HIV infection. Progression. HIV can be managed with ART, often preventing progression to AIDS. AIDS develops when HIV is not treated and the immune system becomes severely compromised. Symptoms. HIV may cause mild symptoms or none at all initially. AIDS is marked by severe symptoms such as persistent fever, significant weight loss, chronic diarrhea, and opportunistic infections like tuberculosis or pneumonia. Reversibility. While HIV is lifelong, ART can effectively control the virus. AIDS is a result of uncontrolled HIV, but its complications can improve with treatment. Why early testing and treatment matter. Early detection of HIV through testing is vital. With timely intervention, HIV-positive individuals can lead healthy, productive lives without progressing to AIDS. Using preventive measures like condoms, regular testing, and pre-exposure prophylaxis, PrEP, can reduce the risk of contracting HIV. Takeaway. HIV and AIDS, though related, are distinct. HIV is a manageable condition with proper care, while AIDS represents advanced HIV infection. By raising awareness and encouraging early testing, we can help reduce stigma and improve health outcomes for those affected. If you have questions or concerns, consult your healthcare provider to learn more.